Hey guys, it's Phil here. Today we're going to be discussing ingrown toenails. So what are ingrown toenails? Ingrown toenails are the growth into the surrounding skin of your nail folds. This is when the edge of the toenail grows into the skin around the nail, causing a lot of discomfort. Ingrown toenails can be very painful and make it difficult to walk or perform your daily activities. There is a potential also for risk of infection. When the ingrown toenail becomes very severe, the break in the skin caused by the ingrown toenail can lead to bacterial infection and further exacerbating the pain and symptoms. So, causes of ingrown toenails. The most common things we see in the clinic here are improper nail trimming, so improper techniques of cutting the nail. Some people cut the nails too short or around the corners too low, which causes the nail to grow into the surrounding skin. This leads to the ingrown toenail. Tight fitting shoes. Shoes that are too narrow or too tight can put pressure on the toes, causing swelling of the skin and sometimes causing the nail to grow into the skin. Injury, so trauma to the toes, such as stubbing or dropping something heavy on it, can damage the nail and lead to an ingrown toenail. Genetic factors, some people are just more prone genetically with different nail shapes. So something more of a wide fan nail shape can lead people to be more prone to it. Some very common symptoms of ingrown toenails. Most common is pain, so intense throbbing pain around the affected toenail. Sometimes it can be very a constant ache throughout the whole day, especially putting pressure on the toes. Redness, so inflammation and redness around the toenail when the skin becomes really red or swollen, causes pain with any pressure against the skin. Very common to see some swelling around the area, some puffiness around the toenail, and some swelling around the edges of the nail folds. Difficulty walking, so severe discomfort and difficulty putting weight on the foot, especially with something like a tight shoe that's going to be putting a lot of pressure on the nail. So when to see a podiatrist? Very important to see a podiatrist early to prevent any further exacerbation of the ingrown toenail, which can help prevent any infections or any severe pain. It requires professional intervention, that way we can safely remove the ingrown portion of the nail with as minimal discomfort as possible. If the ingrown toenail is causing any severe discomfort or recurring quite frequently just due to shape or activity type or even job type, it can lead to infection, and then it is recommended to seek treatment from a podiatrist who permanently get it removed, which can require some a minimal procedure. So, different treatment options we offer. So, removal of the ingrown portion of the toenail. So, conservative early treatment is the most beneficial for a patient with an early ingrown. We can carefully remove the ingrown part of the nail to relieve pain and prevent further irritation. Sometimes we require permanent removal of the portion of the ingrown nail. In severe cases, we can recommend permanent solution to kill the root of the affected ingrown nail. If there is any infection, antibiotics from the GP would really help. So we can sometimes prescribe it or would refer to a GP to promote healing of the infection from the antibiotics. And we can really educate people on corrective shoe modifications. So sometimes we can provide education on which shoe to choose and what's more appropriate to wear. And we can also provide sometimes custom shoe modifications or orthotics, which will provide a wider fit into a shoe, which will alleviate pressure on the affected nail. So prevention strategies. So really important on nail education on a proper cutting technique. So trim the toenails straight across and avoid cutting them too short. Often we find that cutting them straight across and only filing the edges down would help a lot and will prevent any ingrowing nail. Wearing a well-fitting, comfortable shoe, ensuring that there is a wide toe box and a deep toe box, which will prevent any irritation of the material of the skin, material of the shoe to prevent any rubbing on the skin on the nail. Maintain good foot hygiene. So keeping your feet clean and dry, and if you sweat a lot, making sure that we dry the toes after showers to prevent any moisture build up, especially in between the nail folds of the skin and the nail. That would prevent any risk of infection. So if you or someone you know suffers from ingrown toenails, feel free to give us a call or email us to book online. See you guys next time. Bye bye.